So my name is Susanna Ahern. I'm a professor at Monash University and I manage a number of registries. I'd just like to begin by acknowledging the traditional owners of the land on which we meet today and to pay my respect to elders past and present.
So good afternoon, everyone. I'm Suchit Handa. I'm the Director for the Measurement for Improvement team here at the Commission. Some of you, if not most of you, would have seen me at the last SIG and the symposium last year, where I provided an update on the framework. So my directorate and I work quite closely with Cass Adams, as many of you would know, to update the Australian framework for National Clinical Quality Registries. Thanks, Susanna. So I'll just go ahead and share my screen if that's all right then. Yeah, great.
Thanks very much.
And just, Susanna, if I could just get you to give me a thumbs up when this has flipped into presentation mode and you can actually see.
Yep.
You can see the presentation mode. Beautiful. Thank you so much. Good afternoon, everyone. Before I begin, I thought I might just take you on a bit of a journey on how we got here. So as most of you would remember, we had a very strong consultative process to update the framework, and that started off in Jan of 2023. That really, national survey. Of course, there was some work prior to that as well, but that consultative process kicked off in the national survey, went through the national submissions, and then we conducted virtual consultations, targeted consultations as well with a lot of stakeholders, which then we eventuated to that draft revision of the framework, which we released last year. That was the consultative framework. And then after that, we really took the feedback that we heard from the survey, from the targeted consultations, and all those meetings that we had with stakeholders back to our expert advisory group. Some of those members are online with us today. And we really conducted sort of feedback workshops to really refine that feedback into tangible changes in the framework. And that took us through to October and December of 2023. And so where are we now? We are at a process where the framework has been endorsed by the Commission's Interjurisdictional Committee and the Chief Executive Officer. And we're going through a bit of a design process at the moment with an anticipation release date of mid to end of August this year. So I am very much excited to share the framework with you soon. But as it isn't just yet, I will really aim to give you a bit of a sneak peek into what's changed and how does it impact you. So the 2024 framework is really an opportunity to take a moment to pause and reflect. It has come a long way in providing the guidance to the health and government and registry sector on best practice and what is expected of registries of any level. The 2024 framework focuses on making sure registries have a strong purpose, governance structure, data governance processes, technical and security support structures for their ultimate goal and ultimate aim to provide access to clinical information on the appropriateness and effectiveness of healthcare for the purpose of driving improvements in the Australian healthcare system. And this is an overall purpose of the 2024 framework, but how does the framework aim to support this overall purpose? So by providing advice and guidance and best practice to support the success of CQRs and an increasing digitized and digitally enabled health system. It also provides guidance around governance arrangements, reporting requirements, outlier management, and of course, it does have the guidance and best practice around the technical standards, logical system architecture and design, as well as security compliance guidelines. And it goes one step further in supporting the how do you identify modern variation in healthcare and communicate to the relevant health service organization or jurisdictional health department. That communication factor is really, really important. Just as again, a bit of a refresher, this was the overall structure of the framework. So the headers haven't really changed drastically. So these sections are still very much in the framework, and most of you would have seen this. But what has changed? So even though we condensed a lot of information and removed duplication based on feedback, the framework itself is a bit longer than the version you saw during the consultation phase. But that is predominantly due to the inclusion of the checklist for self-assessment. We built in a high-level self-assessment checklist into the framework as suggested by the consultations. And they really assist you as registry operators as well as probably funders in assessing how your registry is performing against the quality standard laid out in the framework. The document reads and flows much easier than previously and connects much more easily with the two supporting documents, the logical and security documents. The two supporting documents have also been consolidated heavily and are aligned with ADHA guidance, the Australian Digital Health Agency guidance on interoperability. The biggest change, however, is we moved away from focusing on so much on describing operative models. So you might remember this as Model 1 and Model 2. There was a bit of that language in the previous framework, and instead took it up a level. So regardless of operating model, as long as you apply the standards and you comply with the strategic and operating principles, no matter what way you set up or operate your registry. And this change was not only driven by your feedback, but also advancements of other program areas across government, such as in AHW, ADHA, state and territory governments, and the wider digital landscape. So one of the challenges, but also opportunities we heard as part of the consultation process was around the need for meaningful consumer engagement to be built into CQRs. So including the inclusivity of consumer involvement in the governance and creating reports that are consumer friendly. So there is an increased focus in the revised framework and suggested strategies to engage with communities, especially vulnerable groups in our communities. And we also provide guidance around how data governance should be molded to fit these vulnerable groups. We've provided clearer roles and responsibilities, but also expectations of these roles, whether you are at the end, or whether you are the end user of a report, part of the governing body, the data custodian, or technical analyst. We've also positioned CQRs as playing a vital role as part of that wider learning health system, really driving home that for CQRs to be effective and fulfill the purpose, they need to systematically provide feedback to all levels of the system, from clinicians to governments, while at the same time making it clear that CQRs can only do so much, and effective partnerships with clinicians, clinical teams, health services is needed to drive meaningful local change. Lastly, one that some of you will probably jump to when the framework is released is approaches to identifying outlier results. The goal of outlier measurement is to rapidly identify situations where patients may be possibly exposed to harm, and each CQR should determine its approach to outlier measurement as appropriate for its clinical focus and the nature of the data that it collects. So instead, we're focused on supporting you developing an outlier policy to best suit your needs. We've clarified about how the alert and alarm system that is considered best practice should be applied, with examples and clear owners and timeframes for each step as well. So what has not changed? There is still a national alignment with the strategy. As you know, the Department of Health and Education and the Clinical Quality Registries program has the national strategy till 2030. And the framework does not move away from the strategy. If anything, it really solidifies under the strategy, and that there are a lot of pillars against that strategy that still need to be worked upon, but the framework is one of the key enablers for that. There is still a very large focus on governance, providing advice and guidance to registry operators to how you set up, but then how do you function that governance, those governance arrangements. The intent of the strategic and operating principles haven't changed, even though you'll see in a new layout, it reads better and flows better and they've been clustered together. The intent of those principles hasn't changed. And delving down a little bit more into data governance, there is much more of a focus around making sure that registries have the appropriate guidance and advice on setting up appropriate data governance processes and structures from collection, analysis, and then ultimately reporting. And then that value and impact of CQRs is still very much clear. So who should use the framework? So as you know, so it's considering you are on the webinar, it suggests that the framework would apply to most of you, if not all of you, regardless of your role. Even though the framework targets those national CQRs operating in areas that represent the greatest burden of disease and the greatest cost of the health system or the variation in care and outcomes, the framework can be used by nearly everyone and anyone to just to have that pause and reflection to see how you comply or how you are being assessed against the framework. Application of the framework is voluntary. However, the quality standard provides a nationally consistent quality framework that can be used by all CQRs committed to improving safety and quality in healthcare. And it was really comforting to see, Susanna, that the results of your surveys is showing that shift. And so the framework is intended for use by CQR operators, including registry data custodians, Commonwealth, state and territory health departments, and health service organization administrators and clinicians. So you can use the framework as a bit of a conversation starter. So if there are health service organizations that are not sure about what do registries do, the framework really provides that guidance and a surety on what is a registry and how it adds to the learning health system for Australia. And of course, it's also relevant for medical colleges and the wider community. So where should you focus? You can focus on all of these or just pick the area you feel that needs a bit of improvement. Now, do you have clear defined purpose and an intended outcome for your registry? Are there clear defined roles and responsibilities across the registry? Has the governing body implemented consistent practices in relation to implementing its strategic intent? Do you have a governance structure that best works for the registry and its intended outcome and purpose? Do you have appropriate diversity on your governance and advisory bodies? It does take a village. So the framework places an importance on engaging senior decision makers, including health service decision makers, medical colleges, consumers, and collaborating on the development and implementation activities. So, and then focusing on data governance. Do you have an outlier management policy? Maybe. How effective is it? Is it serving its purpose? The framework will give you guidance on principally what to do, but it won't be prescriptive on how you do it. It will suggest what can be done, but it will come down to your local context and what works best for the intended goal of the registry. And some of you might be already familiar with this, but I always like to include this whenever I do present, because it's always good to increase the awareness about taking action on that unwarranted variation. So not only does the registry, the framework fit into the wider Commission objectives, but it also supports the National Safety and Quality Health Service standards, particularly Action 1.28 and Action 1.08 as well. So in those conversations with health services organizations, you can say that this is using registry data to inform safety and quality improvement can be an evidence for accreditation purposes. And there is also a guide on the Commission's website on best how to approach taking action on unwarranted variation. As again, for best practice CQRs, the evidence check and then the framework that we've developed in 2024, or will be releasing in 2024, I should say, really goes back to those core principles. The framework does provide guidance for securely hosting and sharing technical infrastructure that is scalable, providing guidance on appropriate governance arrangements that bring together data custodians, clinicians, stakeholders as partners in the CQR governance structure, and for processes for quality operational improvement over time is evident in the policy of the registry. It also implements a process for outlier management. That's another part of the framework that provides clear guidance. And most of you, again, will be very familiar with this diagram that's on the Commission's website, but also as part of the framework. And I always like to include it into the presentations, because it is a very quick, large overview of how the registry's landscape fits in with the wider learning health system. So the framework does provide guidance around roles and responsibilities for registry operators, clinicians, as well as in health services. So where is the clear delineation of responsibility, but then also then where are the greatest opportunities to partner with one another to ultimately have that patient impact. So where do we go from here? So as right now the framework is being designed, and there is a development of some collateral material that will go alongside it, which will take us through to August with the release. And with December 2024 and beyond, there are other supporting resources, fact sheets that are also being developed to better support the framework and for it to be better understood by probably audiences that may not have heard about the framework before. But we are also in very early phases of working up a bit of a program around developing a self-assessment checklist as a separate standalone tool. Of course, the self-assessment checklist is built into the framework, so you'll see it in the August release. But really pulling it out and having it as a bit of a operational tool for registries to use, while at the same time building a maturity matrix and a maturity framework, so that once you do the self-assessment, you can really see where do you sit on the maturity matrix for CQRs across the country. And that's all I had. Thank you, Susanna, and happy to either take any questions now or later.
Thank you so much, Suchit. Look, I think we have got time at the end for questions, so I think that's the plan. We'll have a bit of a panel, but thank you very much. And I have just put a little message in the chat about the questions. So we will have a sort of Q&A at the end, and the idea is if people could please use the Q&A tab, and you get to the Q&A tab by finding 3 little minuscule dots in the bottom right-hand corner of your WebEx screen. If you just normally click on that, and then there's a Q&A box that pops up. So feel free if you get at any time to pop a question in there, and after Jen's had her presentation, we'll be able to start with the Q&A, and I will facilitate that together with some other members from ACTA. So thank you very much, Jen, for coming. Jen is the Director of Digital Health Strategy at the Australian Department of Health and Aged Care. She is responsible for the strategic planning and coordination for Australian government investment in digital health initiatives, as well as ensuring strategic alignment and oversight of key national digital health policy initiatives. So just a small portfolio there, I can see. The title of Jen's presentation is Digital Health Supporting Modern and Connected Healthcare. And she will delve into foundational work underway towards a personalised and connected health and wellbeing experience for all Australians, underpinned by trusted, timely and accessible use of digital tools. Jen will explore the key activities shaping the evolution of My Health Record and broader national digital health capabilities to support the sharing of health information in near real time, encompassing data standards and infrastructure, national healthcare identifiers, and regulatory and legislative frameworks. Well, this is something we're all interested in, so thank you so much for joining us, Jen, and feel free to start whenever you're ready.
Thanks, Susanna, and thank you very much for inviting me here to talk today about some of the work that we're doing across the department. Listening to Suchit speak around the framework the Commission are developing up and some of the key focus areas around making sure there's consumer engagement. We're working towards a learning health system. They're all very much themes that resonate in some of the work that I want to present to you today. So I'm going to attempt to share my presentation. Just make sure that this is working for everyone.
Yep, it's not. Yep, there we go. All good.
Perfect. So what I wanted to talk to you today about is really some of the foundations that we're starting through the department. And I want to kind of base it back in our Australian Digital Health Blueprint, which we published late last year in December. And really give you a bit of an understanding of the direction the department's going in and how we're going to create some national foundations and capabilities across all parts of the health system to support a more interconnected system. And the first areas of focus that we are actually really targeting and doing a lot of work in at the moment. So like I mentioned, we did release our digital health blueprint December last year. This is the first time the Australian government has actually released an investment strategy or a strategy around how we're going to coordinate digital health within the federal government sphere. We do have the National Digital Health Strategy that the Australian Digital Health Agency publish, and that shows the contribution of and direction of the areas that all Australian governments are working towards in digital health. But really the timeliness of the digital health blueprint is really about how we're going to coordinate and play that stewardship role from a federal level on a more person-centred and connected and sustainable health system. So really our vision for digital health is, being able to make sure that information flows around the health system to ensure that we're supporting patients and the carers, that are supporting them as they move through the health system, that we're supporting our healthcare providers, but we're also creating that learning health system. So we do have a vision that we're working towards, which is a trusted and timely and accessible use of digital and data, which underpins a personalised and connected health and wellbeing experience for all Australians. And this is really a vision that's going to anchor the work that we're going to do over the next 10 years from a federal perspective. So our blueprint really is trying to articulate that we need to collaborate, we need to work together, and that we need to all be working in the same direction to create that interoperable health system. We have our outcomes, which is that every Australian has a choice in how they manage their health and wellbeing journey. And that really means that we want to make sure that all consumers have access to their health information that's relevant to them so that they are empowered to be part of that healthcare journey that they're on, that we're supporting our health workforce through digitally connected care, whether it's information at the point of care or support tools, digitally enabled support tools like virtual care or clinical decision support, to make sure that they're running as efficiently and as well equipped to provide high quality care. We also want to make sure that what we're doing as we move health information around the system is that that data is creating a sustainable and learning health system. And what we really want to do is make sure that we've got those foundations in place to make sure that we've got a safe and secure health system from a digital perspective. So the blueprint really was put in place to provide clarity on our priorities for digital and where we're going to invest. But it is really a document that helps us align investment across the department on how we're going to use our funding, our policy, and our legislative levers to create a more connected health system. We wanted to put it out to make sure that there's certainty across the health sector, including our software vendors, our clinicians, our states and territory counterparts, of where the Australian government is heading with our digital health investments. And we wanted to make sure that we had a really clear call out that it's a very collaborative process, that we can't do it alone. We have a very federated health system, and we have the ability to connect our disparate systems to make sure that we can share data seamlessly, but it's going to take time and it's going to take a coordinated effort, and that we had to work together to be able to do it. So for the blueprint, we've got our blueprint strategy, which really lays out where we're going with our vision and the areas we're going to focus on. But what we wanted to do was create a supporting action plan, which we're going to be updating on a regular basis on what Australian government is investing in and how we're targeting investments across different areas of health to help support that health system's interoperability we're working towards. So the crux of what we're trying to work towards is to make sure that a patient's health information can follow them across their health and wellbeing journey. We want to make sure that information is available for them as they transition between care settings, between healthcare providers and healthcare services. We're not just talking about health, we also talk about aged care and disability care as well. That's all part of someone's health journey, all those services. We want to make sure that healthcare professionals have access to joined up near real-time view of information of their patients. We want to make sure that they've got the most up-to-date and important information that they need to make those clinical decisions and have those conversations with their patients about their care. And then we also want to make sure that our health data generated at the point of care can actually establish feedback loops, which is where clinical quality registries come really important to us to make sure that we're creating that learning health system and that we're using data for prevention measures, policy planning, and for service planning as well to make sure that we're delivering a very, very efficient health system. So the areas that we're focused in at the moment, just make sure I can move the slide. We've got 4 core priority areas, which if you have a closer look at the action plan, you'll see really called out what we're doing in the investment space. So the first area we're really focused on is around national standards. So last year, we established the first fire accelerator program called Sparked in Australia. And what we're doing is looking at creating nationally consistent standards for the way we capture patient interaction information and how we share it. So the Fire Accelerator Sparked is a collaborative community-based process and it's open to everyone. And I really am hoping that we do have a lot of CQR representatives as part of the program. And they're working together with our partners, so CSIRO and the Australian Digital Health Agency, who also help co-lead this program, to develop our agreed national standards for use in Australia. The first areas of focus are on a core data set for Australia. And so this is really how we capture base patient interaction information and how we can do it consistently. So there's 2 parts to our Sparked program. We have our clinical groups and we also have our technical groups. So our clinical groups are really starting to define what should be captured and the clinical terminology around how it should be captured. And our technical groups work together on how we can share it consistently to make sure that if we're going to start creating an environment where we move information around, that we're all capturing and sharing in the same way. That is one of the core things that we need to overcome to be able to create that systems interoperability in our federated health system. So we do have another element of work that is currently going through our Sparked program. We are working to create an e-requesting standard on how we can support pathology and diagnostic requests electronically, which goes from request to result. So they're two programs that are actually underway. And then we also have investment that's going to start from July this year on how we can start some planning work to create a nationally consistent standard for the capture of a patient interaction and encounter information from a primary care consultation. How we can consistently capture chronic disease management information from primary care. And then also how we can create a national standard around a patient summary. So our core that we've started developing, which I believe the first release of the core went out in June this year. I'll have to make sure I get some dates out and some information on the Spark program for everyone. But everything builds off the core that we have started building through this Sparked program. So this is, like I mentioned, a very community-based program which has representations from all Australian governments, from all of the major software vendors across Australia. A lot of peak organisations represent in the Sparked program, and then a lot of clinicians and technologists as well. So really, we're creating that pathway to make sure that as we continue to build out our program, that we create the national standards for how we're going to capture and share information between systems. Our next pillar that we're really focused on is around healthcare identifiers. If we want to start sharing information between health systems, from primary care to acute care to aged care, between primary care settings, allied health settings, we need to know who we're talking about, or who is that patient, who is the healthcare provider, and what organisation they belong to. So we have a national healthcare identifier for patients, providers and organisations. We have our legislative framework that was established in 2010 to support national and unique identification of patients, of providers and organisations. But we know that that's not pervasively used across all parts of the health system. So we are starting to do some work around some regulatory change and also some longer term legislative reforms to ensure that that HI framework, healthcare identifier framework, is fit for purpose to make sure that we can share information across all parts of the health system. And I know that there are some limitations right now for CQRs, but they are one of the considerations of how we can actually make sure that we've got the ability to use healthcare identifiers for, research and planning, as well as, just moving clinical information around the health system. So that is work that is underway. We are going to start with some quick regulatory wins while we are working through our longer term reforms. We are also needing to look at legislative reform to make sure that healthcare identifiers can be used across all parts of the healthcare system. We know now that we can use them in healthcare and aged care, but we do need to do some work in the legislative space to make sure that we can extend it out to disability care as well. So as I mentioned, we don't look at, this as just a health system. It's all parts of the care system as people need to transition between care settings. So our third pillar is our health information sharing infrastructure. We are doing a lot of work with the Australian Digital Health Agency on how we can modernise our My Health Record system. We are starting to do some work around changing it from a PDF filing system into a database repository based on FHIR standards. So the agency received funding in 23-24 budget to start that work and to build the ability to capture information in data format, which is going to make it easier to put information back into the clinical workflows from My Health Record for healthcare providers. So this is early work, but the idea is that this work is going to continue to modernise the platform My Health Record sits on to make it more usable for consumers and for healthcare providers. The other piece of work we're doing in information sharing is we are working through our intergovernmental agreement on digital health with all jurisdictions. So all states and territories sign up to this agreement. We have prioritised health information sharing capabilities at a national level. So we have tasked the Australian Digital Health Agency to start developing out an architecture and a roadmap for the establishment of health information sharing capabilities and identifying what capabilities need to be put in place to make sure that we can share information nationally through all parts of the health system. So a year in, we have started having discussions on some of the core capabilities that need to be created in the first instance and how My Health Record is going to sit within this environment. So one of the core things that we need to start looking at how we establish is a provider registry, not a new provider registry, but a function that brings together all healthcare provider information into a single place where we can make sure that we share these details for authorising and authenticating providers to make sure that we're sharing information to the right providers. So there's some of the capabilities that we're actually looking at establishing under our health information exchange capabilities at the national level, and we are working with all Australian governments on how we prioritise and how we fund those capabilities. They will sit within the broader remit of information sharing, and My Health Record is always going to be a core information sharing capability that we will have at the national level. We want to make sure that consumers always have access to their key health information. And so that comes to the next part of our last pillar that we're focused on at the department, is how we can actually create legislative support and change to support the broader sharing of health information. Some of the short-term things we are looking at doing, and we have just received agreement and authority from government for drafting, is how we can enforce sharing of pathology and diagnostic imaging results to My Health Record by default. So this means that from December 24, we are working with all jurisdictions and all parts of industry to make sure that pathology and diagnostic imaging results go to someone's My Health Record. We will put that in legislation to mandate that sharing occurs, but that's only the first part that we're doing for the My Health Record perspective. We are looking to progressively roll out other areas of information which need to be shared. The idea is around creating a new environment that, sharing of information to support patients and providers becomes the norm, and information isn't locked away into clinical information systems. It's not intended to make sure that everything is shared. We really want to make sure that key information is shared, that there's access to a consumer's allergies, to their current medications, to any of their results, any procedures, any devices that someone might need to be aware of as part of their care, to make sure that whoever sees that patient has the most relevant and up-to-date information available at the time. And also that consumers have access to some of this information as well. So while we're working on some of these short-term measures to increase sharing across the health sector, we're also looking at how we can create a legislative framework around the broader health information sharing that we will have once we establish those health information exchange capabilities. What we need to make sure, while My Health Record is very tightly held legislation around who can share, who can access, how a consumer controls their My Health Record, we need to make sure as we create those broader capabilities that we have the right protocols and protections in place around how patients' data is being used and shared. So we want to make sure that we've got the right authorizations for healthcare providers for how they access and what they access information around a consumer. And we also want to make sure that we've got the appropriate consent controls from a consumer perspective in place, that their wishes on how their information is shared and moved around the healthcare sector is actually taken into account as it's moved around. So they're the four core areas that we're focused on at the moment, creating some of the foundational capabilities. The idea around using the blueprint as a guiding document is to make sure that as the department is developing up new policies or programs, that we're starting to look at how we have digital as an enabler as part of those policies and programs that are established, or if they're making changes in current policies and programs, to make sure that we've got a digital lens across and that there's a coordinated effort to make sure that we're all working towards that information sharing environment. So that's probably where I want to leave it now, and then I think I'll open up the floor for questions when you're ready, Susanna. I'll just stop sharing.
Thanks so much, Jen. That were great presentations, and fascinating to see such a huge amount of work that you reel off there, all stuff that's really important and needs to be done, and all of interest to CQRs, and great to know that you're considering CQRs in some of these aspects of work, or many of these aspects of work as well. I just thought I'd start, and I just want to encourage people to use the Q&A function again. We do have a chat function, but I think we're preferring the Q&A function. But I'm sure we've got big attendance, so I'm sure there'll be questions rolling in. I just did want to ask about, I guess, the private sector and also about states. So, one of the issues is we've got state-based legislation that varies, and for example in Western Australia they're not keen to support opt-out registries at the moment, and then in the private sector we've got often lower level of digital capabilities. So I guess there's some particular challenges that we've identified in terms of, data sharing and streamlining data integration. They're obviously on your agendas, those sort of particular issues as well?
They definitely are. So from a jurisdictional perspective, we are working very closely with the jurisdictions. Under our intergovernmental agreement, we do have that core priority around health information sharing. And one of the layers is, how do we break through some of those legislative barriers, and where do we come in from a national perspective to put some standards and protocols in place on how we share? So we are currently doing an exercise with the states and territories on where they have barriers to sharing. We have an example where, New South Wales cannot digitally share transition of care of a patient going from a New South Wales hospital to an ACT hospital, because their legislation prohibits it. So we are looking at those barriers, and that's the Health Information Exchange legislative framework that we're looking at, how we can actually overcome those barriers and how we can start creating some national protocols. So for the sharing of pathology and diagnostic reports to My Health Record by default, we do know that there will be some exceptions where a report should not be shared. And so we've all agreed to actually create a national list for what those exceptions are, not leave it for 9 different jurisdictions to have an opinion, and come together and actually do something from a consistent perspective. So that is one of the mechanisms that we are using. In regards to the privates, we are looking at how we can uplift digital maturity. We do know that there's varying degrees of digital maturity between general practice, between allied health and specialist, and we are looking at how we can start uplifting the digital maturity and the connections and the cyber resilience in that space, because we do know that we do have issues there. So it is going to take time, but as we increase our requirements on sharing, there will be, mechanisms like the MBS that we will be able to use to say, part of your requirement to claim Medicare will be to share this information. So we are looking across all of our mechanisms that we have.
Thanks so much, Jen. And I might ask a question of Suchit as the chair's prerogative. Suchit, thank you so much. And I've been involved, obviously, in a lot of the work that's been done recently on the framework, which has been great. I think you probably touched on accreditation of CQRs. I just wondered if you maybe could just talk about that a little bit further in terms of potentially some of the pros or some of the cons or considerations around accreditation of CQRs. I know that's probably of interest to audience members here.
Thanks, Susanna. So as part of the, I think the consultation process, and you'll soon see the consultation report on our website as well. But the consultations really demonstrated to us that the CQR sector probably isn't ready just now for a accreditation process. I think in the in the thinking of the project and the framework sort of really began back in 2011. That was sort of the vision, that there would be an accreditation process against a set of national standards. So we've got one part of the puzzle. I think the quality standards in the framework are there. But in regards to the accreditation, I think, and just so that the audience understands, the having national standards and quality standards and then having an accreditation process or an accreditation scheme that goes alongside it are two different things. And some might say it's resource intensive. And the question that we really have asked at the moment of the expert advisory group, which Susanna is one of them, is to really say what is the value of and the impact that accreditation will serve if we're really trying to drive home quality improvement at a local level. Is accreditation the right fit, or is it the only model? Are there other models out there? So I think at the moment, the self-assessment process is probably what's going to be active for the immediate future, while we, I think, consult with all of you, all the stakeholders, to really understand what is the model for accreditation, and whether it be peer review, whether it be external bodies, whatever that might look like. We still need to investigate what is going to be the most appropriate method to assure people that registries are fit for purpose.
Thanks, Suchit. I've got a question in the chat now. I think it's for Jen. Is there a plan to introduce any guidance around data sharing frameworks for research with government or individuals, e.g. using safe havens versus sharing de-identified data files using a proper data governance framework?
I'm going to attempt to answer this, and if I don't hit the mark, please let me know. We do have work underway at the moment around using My Health Record data for research and public health purposes. There was a framework that was developed a couple of years ago that we're looking at how we can actually put it into operation, noting we do need legislative change to support the use of My Health Record data for research and public health. One of the things that we have been starting to explore is, as we start creating broader health information sharing capabilities, how we can use that data for research. And we're going to be starting to do a little bit more work closely with the Institute of Health and Welfare around what that means and what that looks like. So right now, we don't have the ability to share data, that is collected from My Health Record. And while we're still working through broader capabilities, how that would work in practice for research. So that would be something that needs to be considered as we move this work forward.
Yep. I also have another question for Suchit. In terms of the national standards and data governance requirements, is that something that I don't believe there's a national standard around data governance for health services at the moment, but correct me if I'm wrong. Is that something that the Commission is interested in including? Have they been talking about that at all? Because that would help CQRs as well.
I think that remit really sits in with AHW, ADHA, with state and territory governments to have that framework for health service organisations. So I think the Commission's at the moment it's not something that we are looking at. However, having said that, there is as we move towards National Standards version 3, which is still a while away, but thinking about how best we can integrate existing national frameworks that ultimately impact health service organizations, how that can be integrated into version 3. So it's up for consideration.
Thank you, Suchit. I have a follow on from. Look, I have a question about a quick question about My Health Record about. Is that modelled on another country? And I guess I'd also be interested in further asking you, Jen, are your plans modelled on any particular system, the plans you've talked about today, on any particular international system, or a mix of the best bits of different systems, or a mix of what we'd like to do and what we can do, or all of the above?
It's pretty much all of the above. One of the things that we've been doing a lot of is talking across countries, what are they doing in this space? Everyone is grappling with health systems interoperability way, and everyone is doing something a little bit differently. So within the Australian context, we have a very federated health system. So where digital health is done really well, it's where they don't have the same complexity across the funders in their systems, and the roles and responsibilities tend to be at one single level within a country. So we are looking at what was done in the US under the QIS Act around health information sharing and issues around data blocking. We're looking at what's been done in the UK with their systems. We're also discussing Sweden, what they're doing. People are actually starting to look to us around how we're bringing all of it together. So I think what we're trying to do is we do have a lot of the national foundations that we need. We do have a My Health Record. while it might not be what we need it to be today, we have a plan to modernise it to help support how information is collected and shared, and also ensure that consumers have access to that information. We have our healthcare identifiers. So we've got some really core foundations that we can leverage and continue to grow over time as we build out this agenda. So we are really looking at, what countries are doing, what they're doing well. No one has really cracked into the primary care space on how they can actually get more detailed information around reasons for primary care consultation. So that is one of the areas of focus that we're going to start, like I mentioned, from July. We know that there's a lot that, of demand where acute want to have more insights into what's happening in primary care for their patients, and that primary care want to know what's happened in an acute event with their patients as well. So how we can leverage what's been done well across the globe and continue to build on that in the Australian context.
Fantastic, very interesting. Thanks, Jen. I don't have any more questions, but I find that hard to believe. As Claudia said, we have a very engaged cohort out here. So I don't know, Sarah or Claudia, if there's a way that we can encourage people to use the Q&A, or to people to put their hands up or anything like that if people are finding WebEx a bit difficult.
There's one more question in the chat.
Yeah, it relates to the previous question. I must admit I don't quite know how to relate it on to the previous question. So it was from Shayla. I don't know if Shayla's able to speak, if she's able to be unmuted, but she asked about, will that be the same for CQR data at the registry end? And I can't quite work out how to add that on to the previous question. I'm sorry. So
There's a question from Eliza.
In the chat.
There's a question from Eliza. Has this level of information also been shared with the hospitals so they understand the importance of data capture? Because often the challenges of quality data collection in registries come from lack of resourcing at the participating hospitals.
That is definitely something we are working with the states and territories on. Our Sparked program is not just for the private sector and for what needs to be captured within primary care. We are working with each state and territory around how we can put some regulation in place to ensure that as we agree national standards, that we are all adopting national standards on how we capture and share information. So that is a long road. We do know that there's been some very ingrained health systems and some very ingrained behaviours on how clinicians capture information, record information, what they do capture and record. So it is going to be a long process on changing some of this, but it is an intent that we're doing things consistently, and that where we have the responsibility to share information, whether it's, for a patient record or whether it's information going to a CQR, that it does start becoming more consistent on how it's done and how it's shared.
thank you, Jen. We're reaching out again. I think we've got two systems happening now. We've got the Q&A, and we've also got the actual just chat, which Claudia read out before. So look, we're due to finish at 4:15, so we could continue to ask some more questions if people have got questions. There was quite a lot of information shared. People may be digesting it. I don't want it to be just me asking questions up here. So I think if we've got a couple coming through here. Okay. Yes.
Currently, there's no legislative requirement. Sorry, the chat's in the way of the question. I can't read it.
I've got a couple here. There's one about how do we find out.
Someone else. Sarah, can you read it out? I can't.
How do we find out more about
to even keep health data electronically? Will that change? So currently there's no legislative requirement to even keep health data electronically. Will that change?
Ideally, I think we do know that there's a lot of uplift across some elements of the health sector where they're not digitally enabled. But I think that's starting to change, and we are looking at what some of our policy mechanisms we can leverage to make sure that we're uplifting so that we do have comprehensive electronic records. There are also other options that we're starting to look at with the Digital Health Agency on those areas or those healthcare providers that don't have digital tools, on how we can provide them some supports to actually start sharing information. That will be an obligation they will have to start doing. So there's some of the things that we're starting to think about, but you know, GPs are very digitally enabled. Hospitals, most of them do have, you know, digital systems of some form. It's really where they invest, and so that's how we're starting to look at where they're investing their digital efforts to make sure that they've got comprehensive clinical records.
Okay, thank you again, Jen. I think maybe we might finish up. I think maybe the technologies. Oh,
sorry,
Rowan.
Susanna, just one last question from Milo about the Sparked program, if anyone's got details on that.
Yes, can we find out more information about the Sparked program? Is that available online? And
I can send some extra information out, but yes, if you Google Sparked, you should be able to find their landing page. But I can share information outside of this.
Thanks, Jen. And there is one more question around, well, can federal policy that supports sharing by default override state and territory legislation, which may not be as permissive? So that comes back to that state Commonwealth legislative issue.
That's working together to overcome those legislative barriers, which we have commitment from all states and territories to work through.
Right. I guess the other group that we haven't touched on so much today are the clinicians and those sort of other stakeholder groups. Presumably you've got engagement with some of those key leader groups as well.
Definitely. And definitely as we're doing those standard development pieces as well, we are making sure that what we capture creates value. So that's why it's clinically led for the Sparked program, that we're not capturing just everything because we can. We're actually looking at what creates value and what do we share that creates value. So we do have the very definite clinical group that sits within the Sparked program to make sure that we keep on track with that.
And maybe just last for completeness, the consumer perspective as well. I'm sure that's included. You know, in registries, we find we've got a variety of consumer perspectives. You know, we often have opt-out registries, and generally we have, you know, up to about 3 or 4% opt-out. So most people, you know, who have a register, are involved in a registry, are happy to participate. But there is also another group of consumers who are less keen to share their data, not necessarily those that are asked to participate in registries, but just part of the broader community. So do you find that's a challenge, or you've got that under control?
Right now, it's not a challenge because My Health Record is consumer controlled, so they can opt out, choose not to have one, but they can also control who can see their data and put controls on what data is actually stored within there. They have the ability to delete data as well. One of the interesting things as we go out to consumers, a lot think that we share information more pervasively than we do. And then those that have a look at their My Health Record are horrified that their information is not there. So we do have a lot of support around the sharing of health information, as long as there is consumer consent and controls in place. So as we broaden out health information sharing, we will make sure that's done in line with legislation and regulation, that, you know, before we can put that in place, is a large national conversation on what does that look like? What are the controls and protocols that, you know, Australians want to see in place before we actually enable that functionality to work within the health system. So same as, like you mentioned, for the clinical quality registries, we find that a lot of people are very engaged and want to participate. Even with use of data, as long as it's de-identified, they can see the value it creates and how it can create value and change for other people that may have similar or, you know, other health conditions. So there is a lot of support. It's just making sure that we're doing it in a safe and secure way.
Yep, I understand that consumer piece is a big part of it as well. We've got a question that's similar to what you've just been talking about. So look, I think we might finish up there. It's 4:14, and I think our panelists have done a great job at answering lots of questions, and their presentations were awesome too. Thank you so much. So I think we'll bring the meeting to a close. In terms of activities of the SIG, as I mentioned, we do have a newsletter coming out later in the week. Claudia will be in charge of, and it'll be her last one actually. I did want to say Claudia's worked with us for 2.5 years, and she's finishing up with my unit and with the hub as part of that. So this will be her final newsletter. I'm sure it'll be wonderful. Thank you so much for everything that you've done for the hub, Claudia. And we'll see you, many of you, at the registry annual scientific meeting as part of the ACTA event in December as well. And please, reach out to the ACTA Registry SIG if you've got any other questions or ideas, and put your hand up for expressions of interest for the organising committee and the working workshops as well. So thank you very much for your participation. We'll see you again.